Okay, great. Okay, well, welcome everyone. My name is Rita Koutsoudiamos, and I'm the Executive Director of the BC Alliance for Healthy Living, and we're so pleased that you're joining us today. I'll start by acknowledging that this webinar is being broadcast from the traditional unceded territories of the Squamish, Musqueam, and Tsleil-Waututh nations, where we have the privilege to live, work, and play. And we're here today to discuss physical activity and air pollution, and how leaders in sport and recreation can continue to promote and support safe physical activity while mitigating exposure to poor air quality. We all know climate change is continuing to put pressure on our environment and our lives. We've all experienced our summers getting hotter and smokier, with a wildfire season that's starting earlier and burning longer. So what can we do when that starts to affect the way we enjoy activities and our time outdoors? How can we, as health and community leaders, encourage British Columbians to find alternatives to being outdoors when there are extreme smoke and mitigating heat events? We have an excellent program lined up, but before we hear from our speakers, I'd like to point out a few things. First of all, we really want to get your input today, so we'll be asking you to use the question feature at the bottom of the screen. Just type in your questions for our speakers as you think of them, and we'll be having a question period after each speaker. We'll answer as many questions as we have time for, and if we miss any of them, we'll send out a post-event email with the missed questions and the answers. And then a question that we get every webinar is whether we'll be posting the broadcast and presentation slides. And of course, it takes a couple days, but they will go up on our website afterwards. So now let me frame the program for you today. As you will all recall, in 2021, BC experienced a summer that broke records, and many of us learned the term heat dome for the first time. With the extreme heat and dry conditions, the BC Wildfire Service fought 1,610 wildfires that year, including one that tragically burned down most of the village of Lytton. That heat dome also claimed the lives of 619 people in less than a week. So this is the very real human toll of climate change, and it continues. Last year, the province recorded 1,758 wildfires in the same period as 2021, which is over 100 more. And because of the continued warm and dry weather, last year's wildfire season lasted well into October. And because of drought conditions throughout this fall and winter, we're starting with a dry spring, which means a heightened risk for more wildfires and thus another smoky summer season. So what does this mean for British Columbians? As well as the tragic consequences of wildfires and heat domes, it also impacts regular activity that contributes to our health and wellness. It constrains the kinds of activities we can do safely outdoors in summer that get our hearts pumping and our bodies moving and make us feel better. It means older adults, families with young kids, and people with respiratory issues or chronic conditions will have a harder time. So our speakers today will discuss ways that we can encourage safe physical activity when air quality is poor, and how we can support our communities during smoke events. Our first presenter, Dr. Michael Koehle, will speak about air pollution, the risks associated with wildfire smoke exposure, and why it's important to mitigate this, especially in people doing strenuous activities outdoors. Our second presenter, Dr. Sarah Koch, will speak to us about protective strategies that coaches, activity, and recreation leaders can take to mitigate air pollution exposure, and ways that organizations can support their communities in keeping safe while still being active during smoke events. So now it's my pleasure to introduce Dr. Michael Koehle. Dr. Koehle is a professor at UBC's Division of Sport and Exercise Medicine and School of Kinesiology. He's also an adjunct professor at the Department of Biomedical Physiology and Kinesiology at SFU. His research looks at the intersection of environmental and exercise physiology. So as well as his specialty on the intersection between air pollution and exercise, he's also done research on altitude illness, exercise-induced asthma, and high-performance sport. So I want to thank you for joining us today, Michael. We're all looking forward to learning more about air pollution, the effect it has on our bodies, and yeah, I can't think of a better expert to discuss this. So over to you, Michael.
Thank you, Rita, and thank you to the BC Alliance for Healthy Living for even putting on this important event. And so I'm going to do a little bit of background, and then Sarah's going to give some really practical advice on what to do when the air quality is poor. So just in terms of background, climate change or the climate emergency is happening, and we can expect worsening air quality as a result of that. And it can be a bit confusing because climate change is, about increased temperatures and increased variability in the weather as a result of greenhouse gases. What we're talking about today is air pollution, which is a little bit different, but it's also a consequence of climate change and a contributor. And so it contributes to climate change in that things like soot from wildfire, smoke will deposit on the ground or in the atmosphere and absorb heat and contribute to the global warming. And as a result of climate change, we can expect more and more wildfire events here in British Columbia. And we can also expect more heat waves and heat events. And in those heat events, we get very high levels of ozone air pollution as well. And so kind of as a result of climate change, we can expect worsening air quality in British Columbia as a result of that. And so in terms of air pollution, it has really significant health effects. According to the World Health Organization, the vast majority of us live in areas where the air quality is worse than the standards set by the World Health Organization. And so that leads to more than 4 million deaths per year. And a lot of those deaths occur in lower and middle income countries as well. So it's certainly a health issue and a health emergency. This is a nice figure that just shows the global causes of death. And if you look at the very right, the highest cause of death is pollution. And that's not just air pollution. That includes water pollution as well. But it is a significant cause of mortality worldwide. And specifically in terms of air pollution, it has multiple effects across our medical systems. And the ones that I'm just going to highlight today are cardiovascular, so heart and blood vessels, respiratory, diabetes, and cognition. And so it increases our risk for ischemic heart disease, so heart attacks and stroke. So that's naturally highly significant. And then we have a lot of respiratory consequences from air pollution. Diseases like chronic obstructive pulmonary disease. So that includes emphysema and chronic bronchitis. Those can be increased by poor air quality. And then we have increased incidence of lower respiratory tract infections, and then lung cancer. Just by living in a city, even if you don't smoke, by being exposed to that chronic air pollution, you're actually at an increased risk of lung cancer. And so these are quite serious consequences. One of the newer associations we're seeing is type 2 diabetes is increased with exposure to particulate matter air pollution. And I'll talk a little bit about the different types of air pollution in a second. And then maybe one of the most concerning ones is that there's a strong association with decreased cognitive performance or dementia in terms of air pollution leading to that. And so it's definitely a significant health concern all across the human body. We're going to be focusing today on exercise and physical activity. And just, why is that different? Why do we even want to talk about that? Well, there's a big potential for an interaction between exercise and poor air quality. And the reason is exercise, when we're active, doing work activity or sport or physical activity, our metabolism is increased, our metabolic rate is higher. And so when our metabolic rate is higher, we're going to breathe more. So the amount of volume of liters of air that we're going to breathe in and out in a minute is going to increase. As well, during intense exercise, we're not able to meet our respiratory demands entirely through breathing through our nose. So when you're going very hard, you tend to breathe more through your mouth. And the nose is a natural filter and humidifier of air. And so by bypassing the nose, we have a little bit less filtration as well. So we have sort of an increase in inhaled dose as well as a decrease in the filtering capacity. And so this can lead to more deposition of particles from air pollution in the lungs. The other thing that we have is the lungs themselves are sort of interface between the outside air and the circulation. And that interaction is called the diffusing capacity, the ability for gases and particles to get from the lungs into the bloodstream. That's increased during exercise. So if you look at these four factors on the right, exercise has the potential to increase the dose of air pollution and sort of the depth and the amount of penetration that air pollution has into the body. And so naturally, we want to understand what happens when we exercise during times of poor air quality. And so if we look at the lay press or the media, we can see really conflicting recommendations. So this article on the right says that exercise when air pollution levels are high can do more harm than good. And then this article on the left says the opposite: dirty air affecting your health, pedal harder. So for members of the public or clients that you're working with, it can be really confusing. And usually what that means is that there's, when we have conflicting opinions, it means that there's a lack of science or a lack of good research there. And so what we've been working on is trying to fill that gap, try to understand the interaction between air pollution and exercise. And so when we do that, we want to think of what we call as the recipe of air pollution. So really briefly, air pollution can be a mix of gases and particles, and the gases include things like ozone. So ozone is a secondary air pollutant, and it's created on hot, sunny days when the ultraviolet light of the sun converts other pollutants like volatile organic compounds or oxides of nitrogen into ozone. So on very hot, sunny days, if you look at the air quality, you'll often see that the ozone level is higher. And air pollution will have these gases mixed in with particles, and they can be things like soot, which we see a lot of in wildfires, or dust or metal, and even pollen would count as a particle. And so every day and every time of day, we get a different recipe of air pollution. And so today in the lower mainland, it's surprisingly lots of rain. And so that would be probably low in particles because the rain washes that out, and probably low in ozone because we don't have a lot of ultraviolet light. But later on in the day, if the sun comes out, there may be slightly more ozone. So that pollution is going to be quite different during the day and by different seasons. And if you're up in Prince George, it's probably raining less, but you may have more particles generated from industry or different particles there. So the recipe is changing by location, by time of day, and by season. And you want to take that recipe into consideration when you're looking at the effects of air pollution. And so to simplify, in terms of the British Columbia recipe, Rita laid it out really nicely already, but we have two main recipes that we deal with depending on the situation. So when the wildfires are prevalent, the air quality is really heavy in particles and particulate matter. And that's why the visibility is poor. We have difficulty seeing the sky. And then when we, as Rita was mentioning, we have these heat domes, then we get very high levels of ozone as well. And these aren't exclusive situations, but the heat dome that Rita was mentioning, we had the highest level ever of ozone in Maple Ridge during that time. And so we have, much of the time, we have quite good air quality, but then we can often have very poor air quality, either heavy in particulate matter or heavy in ozone. And so I oversimplify a bit, but when I sort of discuss the health effects around exercise, I like to sort of put it into the particle-heavy air pollution and the ozone-heavy air pollution, because the effects can be quite different. And very briefly, how do we study this? There's a few different models that we use to study air pollution, and they each have their advantages and disadvantages. And so one of the things that we do a lot of are acute exposures to air pollution. And so you see this figure here, we have a research participant, and in this study, they're actually breathing diesel exhaust, which is heavy in particles, while they're exercising on the bicycle. And there's advantages to this in that we can control the pollution that we're using to expose the participants. We can do it quite well, and we can repeat it quite well. So every participant gets a pretty consistent dose of air pollution. The other thing we can do is we can do pretty decent blinding, in that we can have a sham or a placebo condition where they're getting clean or filtered air, and then we look at the same research outcomes. And surprisingly, the blinding is really quite good in that the way we have it set up, they have the participants aren't able to reliably tell which day is the pollution day and which is the clean air day. The disadvantage is these are generally short studies. We can't follow the effects of pollution over years following exercise and air quality. And the outcomes we look at are what we call surrogate outcomes, things like lung function after exercise, things that don't lead directly to health outcomes like stroke, heart attack, chronic obstructive pulmonary disease. Another thing that we do is we do exposures in the real world so that they get a recipe of real world air pollution. So in this study, we had participants with high blood pressure walking up and down a congested street. This is Georgia, right near Burrard. And we had the comparison condition, the control condition, we had them walking out at the tip of this is Canada Place here, at the tip of this pier here, where the air quality was quite different. And so the advantage of that is we have a very representative air pollution for, in this situation, downtown Vancouver versus out over the water. But the blinding isn't very good. When you're walking out here on a pier, you can probably guess that it's better air quality than right next to a bus in downtown Vancouver. And so again, there's advantages and disadvantages there. The other thing that we rely a lot on is epidemiology studies. So these are very large studies which use very large samples and follow them over very long periods of time, maybe 15 years or more. And the advantage of that is that we're getting the long-term results of that, and we have large sample size, which is good. But then we're not able to blind the participants, and there's other sources of bias. Perhaps in terms of people that have a high level of physical activity may have other things that can affect their health in their favor. They may have higher socioeconomic status or better nutrition or other factors such as that. And so we call those confounders. So we have to look at all these different models of research and studies that all have their limitations and sort of mush them together to come up with a consensus. So when we talk about the effects of air pollution and exercise, we want to talk about really two things: chronic effects, so long-term effects. What are the long-term effects of being an active person when the air quality is poor? That would be the chronic. And then we would look at acute effects. So if the air quality is really bad today and I do a hard workout, how does that affect my workout, and how does that affect me in the hours after the workout? So that would be the acute effects. And we also like to look at health effects. And then for some situations, we also want to know about performance effects. So for people engaged in sport, they want to know if that's going to affect their performance. So we'll talk a little bit about each of those today in this backgrounder. Okay, so first, the chronic effects. And so the way to study the chronic effects is with these large epidemiological studies. And so this study here looks at 52,000 people in Copenhagen. And what they did is they looked at their basically their postal code, and they looked at one pollutant in that postal code, and they looked at how active they were by self-report. So basically by questionnaire, you know, how much sport do you do? And then they followed them for a very long period of time, on average about 13 years. And they looked at important things like mortality, how many of them died, and whether what caused it: cancer, respiratory disease, cardiovascular disease. And in a nutshell, what they found was that although air pollution leads to increases in these causes of mortality, the people who were more physically active had less mortality, and that was independent of the levels of the pollutant. They used NO2 as the pollutant there. And there've been, since this time, there've been multiple studies that have similar designs that have kind of confirmed this, in that the air pollution is bad for your health, but it's not so bad to overcome the positive effects of physical activity. And so that's a good key message. And then when we break it down and look at other causes, so this study looked specifically at respiratory and cardiovascular, and they looked at particulate matter as a pollutant. They basically found the same thing, in that there's more mortality when there's worse air quality, or when there's more air pollution, there's more mortality, but that the physical activity still was beneficial in terms of health. When we look at specific conditions like diabetes, the same thing happens. When there's more particles in the air, more air pollution, more people get type 2 diabetes, but the physical activity still helps prevent the type 2 diabetes, even in the setting of air pollution. And this study was looking at cognition or dementia, and they divided air pollution into different quartiles, or actually tertiles. So sort of they went to low, medium, and high air pollution. And in the low and medium air pollution, physical activity outweighed air pollution in terms of preventing dementia. In the very high air pollution situation, there wasn't a statistically significant benefit from physical activity in preventing dementia. There was still a trend for that. So in the vast majority of situations, physical activity is still effective in preventing these diseases, even when the air quality is poor. And so the important message here is that air pollution is bad for our health in many ways, but in most situations, being physically active is still beneficial, even when the air quality is poor. And so if you have to sort of remember one slide from what I'm saying, is air pollution is really bad for you, but it's not, and exercise is really good for you. And over the long term, it's important to stay physically active. So being sedentary in an area of poor air quality is not beneficial. We want everyone to stay physically active. And in the second part of this webinar, we're going to learn some strategies about how to do that as safely as possible. Okay, and so now talking about acute effects. So we were just talking about over years to decades, the effects of air pollution and exercise. Now, what about what happens when you go and exercise in bad air quality? What are the effects during and right after? And so we did this review of all the studies that looked at moderate to vigorous physical activity in air quality, in air pollution. And we divided it up into different pollutants. So ozone, and then traffic-related air pollution, and then there was a separate area category for diesel. So this is the findings that we had for ozone. And remember, ozone is going to be really high on days that are hot and sunny. And so in the British Columbia context, heat dome would be a very high ozone situation. But generally, those hot summer days are days when we're going to have high levels of ozone. And what this figure shows here is it's kind of a different figure than what you've probably seen from a lot of studies, is that it's not showing actual data from each study. Each block there represents a research study that's been published. And it's divided into 3 columns: harmful, conflicting, we can't tell, or beneficial. And so if you see on the left, there's a lot of studies that show harmful effect on pulmonary or lung function in ozone. And you can see that there's no studies that show a beneficial effect of ozone on lung function. And so when we look at what that's telling us is there's a considerable amount of evidence saying that if we exercise in high ozone, our lung function is going to be acutely worse. And then if we go to the second row, we basically have the same findings for symptoms. There's 3 studies here that show maybe there's some beneficial effects on symptoms. You know, when you exercise, you may feel sort of a general sense of well-being. But in general, the evidence shows that your symptoms are worse when you're exercising in ozone. And that makes sense. There's also some evidence that there's more inflammation and some evidence that exercise response, so things like VO2 max or almost performance is worse in ozone. And so if we sort of take this as a whole, what it tells us is acutely, during and in the hours after exercising in high levels of ozone, we seem to have more symptoms, worse lung function, and our exercise response is worse. And so that's a pretty clear message across a large number of studies. Now, when we look at particulate heavy air pollution, so this is a bit of an oversimplification in that a lot of these studies were looking at air pollution from traffic, so not direct wildfire studies. And so there's a bit of a leap or an assumption there. When we look at this plot here, it's called a harvest plot, we can see that for pulmonary function, there's as many studies that show harm, meaning decreased lung function when you're exposed to traffic-related air pollution, as there are studies that show a beneficial effect. And for things like inflammation and exercise response, it's quite balanced. Maybe cardiovascular function, and this is typically things like heart rate and blood pressure, there seems to be a difference. So when we go back to the ozone, where we see the vast majority of studies showing harm, and then traffic-related, where it's a little bit of a muddier picture, what we take that to mean is that the effects of more particle-heavy air pollution is a bit more inconsistent than ozone. Probably there's an increase in blood pressure right away after exercise, and that's what we're finding in our own studies. But in terms of lung function and symptoms, it's much more inconsistent. And so if we had to summarize, dividing ozone, which is more the heat dome event, we're having worsening of lung functions and worsening of symptoms in terms of health effects acutely. And then in terms of particulate, we're having some inconsistent health effects, but maybe some effects on blood pressure. So it's a kind of a slightly different picture than the chronic. So now when we look at performance, this is sort of how you're going to do when you're doing sport. So it's not sort of the health effects. We have a little bit of evidence around performance. And so looking at ozone, we know that this is an interesting study here on the right. It was in a health economics journal. But what they did is they looked at thousands and thousands of athletes going to track meets, and they looked at the level of ozone at the track meet and the level of ozone at the home, the athlete's home. And the athletes that went from a good air quality, low ozone environment and competed in a high ozone environment, they were slower, they performed worse. And so that's interesting. It seems that, well, from our review that I showed earlier, we showed more symptoms, which can affect performance. And for outcomes like VO2 max, there are some studies show that it decreases. And then when we look at absolute performance at a track meet, it seems to decrease. So we take that to mean that there's probably a pretty consistent slight decrease in performance when you're exercising in ozone. When we look at more particle-based air quality, one of the best studies was this one done from the University of Sao Paulo from our colleagues there. And what they did is they had athletes perform a time trial, a cycling test where they have to cover a certain distance, and they breathe either filtered air or Sao Paulo traffic air. And they had no difference in the time to complete the race and no difference in the power output during exercise overall, or really at any time point over the course of that race. And when we did our own diesel exhaust work, we couldn't find any acute performance differences. So again, it seems the effects acutely of ozone seem to be quite consistent. But the acute effects on performance of more particle-based air pollution is not as consistent. Definitely, there are long-term effects of particulate matter on health. It's just that we're not able to see it acutely as easily. Okay, so in summary, ozone decreases your VO2 max during exercise, decrease in running performance, and worse symptoms. And then in terms of particulate matter air pollution, it's quite inconsistent in terms of performance. And so that's the sort of summary that I wanted to talk about in terms of both health and performance effects before Sarah talks about strategies. One thing I wanted to raise is most of the people that are attending this webinar are going to be pretty interested in physical activity and promoting physical activity. And this is a really interesting paper that was published just a little over a year ago. And they talk about the messaging around air quality and physical activity. And that's the reason that motivates Sarah and I to give these talks, is because the sort of the tendency is air quality is poor, we're not going to do any activity, any exercise or activity. And so then what happens is people in areas that have poor air quality, there's a tendency to become more sedentary. And so what that's leading to is this sort of double pandemic. They call it a syndemic, sort of two pandemics occurring at the same time. The negative health effects of air pollution are added and perhaps synergistic with the negative effects of a pandemic of being sedentary. And so that's what we're trying to push back against or prevent. And so I guess that's why we're appreciative of the BC Alliance for putting on this, to get that message out there that overall, we still need to stay physically active, and we just need to be smart about it. And so in terms of take-home messages from the first half, air pollution is bad for our health, and that is incontrovertible. And it's bad for health 24 hours a day, 7 days per week. And so if you're in a location where you have 2 or 3 weeks of really poor air quality once or twice a summer during wildfire season, that air pollution is affecting your health all day, 7 days per week, and you want to reduce your exposure as much as possible. Overall, chronically, the health effects of exercise are not reduced by air pollution, maybe in that one situation at very high air pollution in terms of dementia, but overall, we need to keep people physically active. And then really just to sort of think about the recipe and have slightly different strategies depending on the air quality. And so a lot of people have been involved in the research and work put into this, and I'd just like to thank them for that. And yeah, I think I'm looking forward to the questions and discussion. So I'm just going to stop sharing there.
Excellent, Michael. Thank you so much for that great overview. So I'd just like to remind everyone that we've got that question button at the bottom there. So please go ahead and throw in your questions, and we'll ask while we've got Michael here, we'll ask him some questions. And so yeah, thanks. That's so interesting, and it sounds like you've really got your work cut out for you in the next while, given the inconsistency and of messaging, and I really like how you found that one study at the end that really laid out, air pollution is bad, exercise is good, and we need to really figure out a way to promote exercise safely because we're dealing with this endemic now. I guess one question is, it seems like a lot of the research is done with high performance athletes, and just wondering about, what the impact is on just basic physical activity, people walking in their neighborhood. If there's been much looking at sort of moderate physical activity.
Yeah, and so certainly not all of the research is done on elite athletes. We generally choose people that are recreationally active. Well, first of all, there's sort of two groups of studies. I would say there's the healthy individual studies, and then there's clinical populations. And so I talked a little bit about a study on people with high blood pressure that we were doing. And Sarah's PhD, a lot of it was on people with asthma. So we definitely need and are looking at those populations, and we need to sort of consider them differently. One of the reasons we do a lot of work in healthy individuals is healthy active individuals is because we want to make sure that if someone's sedentary and then we put them into a study where they're exercising, we don't want that to be another intervention. We don't want to confuse it. So we don't want other conditions or being sedentary to be confounders in the study. And so that's sort of one of the reasons that we would do that.
Right.
But definitely we're already doing clinical populations and wanting to do more and more of that.
Right.
The reason, that review that I put up looked at moderate to vigorous physical activity was because a lot of the studies use a very odd design where they have people exercise for 6 hours, and it would be something like equivalent of gentle walking for 15 to 30 minutes on, and then they would rest for 30 minutes. And we kind of wanted to not include those in this study because they didn't seem all that generalizable.
Right.
And it was sort of an old way of looking at exercise as a means to increase pollution dose, as opposed to actually a very complicated phenomenon that should be part of our life. And so we wanted to sort of exclude those studies and instead include studies that really had what we call meaningful physical activity. And it's not super intense activity, but just, you know, the equivalent of a brisk walk or above, or hiking or above.
Yeah. Oh, very good. Well, we've got a couple of questions now. Sandy, I think your question about masking up, I think we're going to put that on hold because I believe Sarah's going to get to that. But I have a question here from Angela that asks that, I'll just read this out. She says, wildfire smoke is quite different from traffic air pollution. It's a pretty complex mixture of particles and gases. So it will likely not fall into the particulate bucket or the O3 bucket entirely. What's your thought on that?
Yeah, you're 100% correct. And that's why I was saying it was a bit of an oversimplification and a bit of a generalization. And so we actually, maybe 3 years ago, I think it was 3 years ago, both Sarah and I, we worked on a study that was wildfire smoke specific. And what we did is we did all the control exposures, and then we waited for wildfire season. And that was basically the only summer in the last 7 summers that we didn't have bad wildfire smoke. And so it was sort of an epic fail on that part. And so, yes, it's an assumption. And that's the problem with all these studies, is none of these studies are perfect. And we have to sort of look at the aggregate and make oversimplifications and assumptions to make a conclusion. But yes, it'd be great if we could actually do wildfire smoke as well. We just have to make compromises, unfortunately.
Yeah, it's tricky with real life conditions and ethics. We've got a couple of questions in the chat here. I think the one about physical activities indoors is interesting. So there's there's discussion around indoor air pollution. So physical activities can be performed indoor: yoga, swimming, Wii computer games. Indoor air pollution is 60% of the outdoor pollution, or lower. So especially places with insulated places and or air filters. So that's interesting question. And I'm not sure if this is something that we want to hold off for Sarah, or if that's something that you want to address is the issue of indoor air quality.
Yeah, so Sarah is going to talk about that.
Okay.
And it's important. I think if you just want to, one comment is we just don't want to assume that indoor air quality is always better than outdoors. And there's a lot of situations where especially during wildfire season, when you actually measure your indoor air quality in a high quality environment, you're still getting significant penetration. And then there's also indoor sources of air pollution as well, which Sarah will talk about. And so sometimes I'll just say sometimes it's a good alternative. You just want to be confident that you are in better air quality than outdoors when you do that.
That's also tricky in terms of the ozone piece. I know that the coroner's report on those 619 deaths that resulted from the heat dome, a large proportion of those happened indoors too. So that is also something that we have to be sensitive to from an equity perspective, because not everyone has access to indoor spaces that are cool and that have clean air. So that's here's exactly one from Scarlett Maloney, who's with the University of Suffolk in England. So she says, in your opinion, Michael, how much attention should be paid to the speciation of particulate matter, e.g. PM10 from traffic versus PM10 from salt spray by the ocean? Thanks for the talk.
Yeah, and so it's a great question, because particles can be heavy metals, right? Which naturally if they're crossing into the circulation, you would expect them to have more significant health effects than pollen or salt from the ocean. And I guess the answer is we really need more research. That's because we have quite a limited number of studies to look at, especially in the exercise space. And we've, in that review that I was talking about in terms of the acute effects, that's all the studies that we went through, I think, more than 3,000 studies and got all that we could include in terms of quality, and there would be no studies that have that kind of speciation. And so I think that's a goal down the road, is to have more research, to have more granular knowledge of the differences between the different sources. Like the earlier question about wildfire being, a lot of black carbon and soot compared to salt. And so right now, I think we're having to oversimplify, but it'd be nice to keep pushing that research.
Mm-hmm, mm-hmm. I have another question here from Tom, who asks, is there any information in regards to chronic/acute effects in children and any other further considerations on their developmental needs?
Yeah, the one that strikes me the most is that when we look at prevalence of asthma and exercise-induced bronchoconstriction, so there is some evidence that I think the first study that did this was looking at ice hockey players who are exposed to ice resurfacing machine pollution. The prevalence will increase over time with exposure to air pollution for things like exercise-induced bronchoconstriction and asthma. So it is definitely a concern. And that would be the number one thing that I think about in terms of kids and development. Actually, there'll be a really nice study coming out of Belgium in the next month or so that's really doing a nice job looking at that. And it's definitely an issue. And one of the things that we really want to push is monitoring, in terms of we don't have good quality data in terms of air quality inside the arena where the children are competing, or in a soccer stadium and stuff. And so that's one thing that we really need to push for, is so that the children and the coaches and the parents are more informed about what their kids are exposed to as well.
That's great. Well, thank you so much for that, Michael. Wonderful. And I'll just ask people to continue sending in your questions as you think about it, because we will have, hopefully we'll have a little bit of time at the end for another sort of round. But now I'd like to turn it over to Sarah, Dr. Sarah Koch. So Dr. Koch is an assistant research professor at the Barcelona Institute for Global Health. And for her doctoral work at UBC, she used controlled laboratory settings to study how physical activity in air pollution affects cardiorespiratory health in adults. And thank you so much for joining us today, Sarah. We're excited to hear about the protective strategies and how communities can take action. So over to you.
Thank you very much, Rita. I'll just go ahead and share my slides. Okay, I believe you can see them now. Okay, so first of all, good morning, everybody. I'd like to thank all of you for being here. It's really exciting, and it's really also an honor and a privilege for us to speak to you about the work that we've done in the past couple of months together with Mike and the research team. And I'd also like to specifically thank the BC Alliance for Healthy Living, specifically Rita, Brenda, Twyla, and also Sarah Jane for making this webinar happening. And so in the next 25 or 30 minutes, I'll be talking about this project where we really dug through the scientific literature to identify personal level strategies that help us to reduce or mitigate the risk from air pollution exposure so that we can continue to enjoy and benefit from being physically active. Oh, 1 second. Here. So my talk will essentially be split into 2 sections. I'll be talking about strategies that can be used while training or while being physically active or even while competing. And then other strategies that are more important either before or after being physically active or after competing or training. And so specifically what I'll talk about is how physical exercise or exercise intensity can be or cannot be used to reduce the risk. We talk about indoor exercise, which Gloria and Cornell have already asked about. And we'll talk about reducing the exposure to air pollution by, say, geographical distance, but also by time. And then when we talk about the pre and post training strategies, that will include air pollution monitoring, then also how we can keep pre-exercise or pre-competition air pollution levels low. And that will include the use of face masks. So Sandy will talk about that there. And then we'll finally wrap up the talk by talking about medications, supplements, and multi-day acclimation, which you've already heard a bit about in Mike's talk. So Mike already spoke a bit about why we're really concerned when we're being physically active when air pollution levels are high. And I prepared this slide to just sort of explain it in a different way. So really, as you know, when we start exercising, all of us start to breathe or inhale more air. We start to take more breaths per minute. We start to breathe more deeply. And that really means at the end of the day that a greater dose of pollutants can enter the mouth. Some of these pollutants that enter the respiratory tract will get exhaled right away, but some pollutants might actually get deposited in the lungs. And some other pollutants make it even further. They get absorbed into the systemic blood circulation. And once they are absorbed, they can essentially reach any organ and cause harm to our health or to our physical or athletic performance. And so I guess it makes sense to all of us that the optimal way to really reduce the risk from air pollution when we're being physically active is to reduce this inhaled dose of air pollution. And the inhaled dose of air pollution is defined as the amount of air that we are inhaling. This is also called minute ventilation or just VE, and multiplied by the ambient air pollution concentration and the duration that we are exposed to. And I guess one way to really keep this inhaled dose of air pollution low is by reducing the amount of air that we're inspiring or inhaling. And that, one might think, can be done by reducing the exercise intensity. And I want to show you a study that essentially helped us to dig a bit deeper into this. And this is the doctoral work that was done by our colleague, Louisa Giles, under the supervision of Dr. Michael Koehle here at UBC in Vancouver. But before I go into the study, I want to explain to you what the sort of study setup looked a bit. And I know Mike already did an excellent job at outlining the different research approaches that we have available. I just wanted to take a minute or so to really show to you what this air pollution exposure booth that we use. It's actually located at the Vancouver General Hospital and is led by Professor Chris Carlston. Because what you see here, I think quite nicely, is this plexiglass booth, which serves as the air pollution exposure chamber. And then the hoses, I hope you can see the arrow when I just move it around on my slides here, that are connected to a diesel engine that is sitting outside the lab. So here's the diesel engine. It is turned on or off. It generates diesel exhaust, which then gets filtered into this exposure booth. And as you can see here, we actually had people exercise outside the booth, but we had these hoses connected to the inhaled and exhaled side of the participants to essentially assure that people were breathing the same air that we were generating inside of the booth. And the reason for why we had participants exercise outside was because we just found it challenging to maintain temperature inside the booth. So you will see that I actually refer to this exposure chamber a couple times as we go through this talk. I'm going to show you 3 studies to essentially explain to you how the generation of these personal strategies were done and how some of the studies that we conducted contributed to them. So let's get back to this whole topic of exercise intensity and Louisa's work. So Louisa's goal with her PhD was really to assess whether high or whether higher exercise intensities would essentially worsen the negative effects of air pollution exposure as we're exercising because of this increased inhaled dose of air pollutants. What she did is she asked participants to come to the laboratory on 7 different days. The first day was essentially a screening day. And then on the remaining 6 days, participants either rested for 30 minutes while sitting inside the exposure booth, or they performed a 30-minute cycling bout at a low intensity or a 30-minute exercise bout at a higher cycling intensity. And they repeated this triad essentially twice, once being exposed to clean filtered air and once being exposed to diesel exhaust. What you can see here is that Luisa measured a number of respiratory, cardiovascular, and inflammatory measures before, right after, and then 1 and 2 hours after the completion of this exercise test. And then with a different set of measures, Luisa actually looked at what's going on during the 30-minute exercise bout. And before I show you the result, I want to take you through this sort of hypothesis process of what we were anticipating to see. So I guess to all of us, it would make sense that when someone exercises for 30 minutes in polluted air, health impacts would be negatively impacted when compared to breathing clean filtered air. On top of that, what we would assume is that this negative effect of air pollution exposure would be worsened by an increased exercise intensity because people inhale more polluted air. What you can see here is that that's not actually what Luisa found. So we'll go step by step, and I'll first orient you to the slides on the top. So we'll first look at the parameters that Luisa measured during the 30-minute exercise bout. You can see on the very left, she looked at minute ventilation, so the amount of air that was needed to complete the 30-minute exercise bout. Then you see here oxygen consumption, here we go, which is the metabolic cost to maintain the exercise throughout the 30 minutes. And then you can see here the rating of perceived exertion for lungs, so essentially breathing discomfort, and then leg fatigue in the final figure. All of these figures are set up that you see on the very left, the rest condition, in the middle, the low intensity condition, and then the high intensity condition on the right. And in the white bars, you see the filtered air, in the black bars, the exercise, or the diesel exhaust exposure. And what you can see when you just focus on the very left figure for the minute ventilation is that it is no surprise, as exercise intensity increased, people increased the amount of air that they were breathing during the 30 minutes. So that's exactly what we anticipated. When you look at the low intensity part, or the 2 bars here in the middle, you can see that the minute ventilation at the low intensity exercise was higher when people were breathing diesel exhaust compared to filtered air. However, this difference between the diesel exhaust condition and the filtered air condition was not really replicated or even magnified by the high exercise setting or high intensity exercise setting. And that's contrary to what we would have expected. And you can see the same picture essentially for the oxygen consumption when you look one slide over to where it says VO2. So that's in contrast to what we had anticipated. What you do see when you look at breathing discomfort and leg discomfort, you can see that essentially for every exposure, be it at rest, for the low intensity setting or the high intensity setting, the level of breathlessness and the level of leg fatigue that participants perceived was higher in diesel exhaust when compared to filtered air. So that's essentially a bit more what we would have anticipated. But again, the difference between low intensity and high intensity was not really seen here. There was no magnifying effect. And I made our lives a bit easier by showing you the pre-post results in just one sentence by indicating to you that really the exercise intensity had no magnifying effect here of the diesel exhaust exposure when compared to clean air, either here, neither on the lung function, the blood pressure, or the vascular health parameters that Luisa measured. So in summary, what we can take away from Luisa's study, but also the other studies that we dug through, is that exercise intensity doesn't really appear to potentiate these adverse effects of air pollution, but we do need more research for sure. Overall, it is still a very good advice to keep this inhaled dose of air pollution low. And I'm going to talk to you next about another way for how this can actually be achieved. So, you remember this figure? We looked at essentially exercise intensity as a way to reduce the inhaled dose by lowering minute ventilation, which was not really supported by the research that I have shown you so far and the research that we found when we did this larger research project. Now, what I'd like to show to you is another way of how an inhaled dose of air pollution can be reduced, which is by essentially reducing the air pollution concentrations that we expose ourselves to by distancing ourselves from the source of air pollution geographically, but also by time. So I'm going to show you this with the help of this heat map here that is available for, say, the city here of Barcelona. What you can see here is the area nearby my work. So where you can see the black dot, this is where I work here in Barcelona. You can see in the figure essentially the NO2 levels on a heat map, meaning that the darker areas indicate lower air pollution levels and brighter colors indicating higher NO2 levels. You see that I took this screenshot last summer at around noon, and both the particulate matter, so PM10 and also NO2 levels were quite a bit above the new WHO guidelines for the respective pollutants. So things weren't really great that day. And on that day, I had to go to an area in Barcelona, for those of you who have visited before, which is called Plaça Catalunya. It's a quite popular area because it's central. There's a train station, and you can see the route that I wanted to take by bike on that day in the orange line here. And what's neat about this Lobelia Earth website is that they use air pollution and machine learning to really put together an estimate of what someone's air pollution exposure would be for a given distance or route in the city. So you can see on the top left, if I had left on that day, right in that moment, to do that bike trek, I would have been exposed to about 34 micrograms per cubic meters of NO2. However, what you can see written in small just below is, if I'm able to wait for 2 hours to do this bike ride, I can actually reduce my exposure to NO2 by 26%. If I have only 1 hour that I can hold off, I would reduce my exposure by 12%. The way this is calculated is that this website essentially takes into account diurnal or daily fluctuations of air pollutants. So NO2, or nitrogen dioxide, is a pollutant that can be, like, it's a sort of a city pollutant. Well, I don't want to say that this pollutant is only present in cities, but in cities, what one can see quite nicely is rush hour. It's driven by traffic. So when rush hour comes into the city in the mornings, typically NO2 levels go up. You see a spike at the bottom in this sort of time figure where you get a spike. This was Monday morning. Then pollution drops down. And in the afternoon, when the cars are leaving the city again, we get a second spike. And because it was noon when I looked at this, or was thinking about doing this bike ride, I got the recommendation to hold off a bit because the NO2 levels were actually thought to go down a bit more. So that's what we mean by how you can reduce your inhaled dose of air pollution exposure, not through modeling or modulating your exercise intensity, but by reducing your air pollution exposure by picking a time of the day where hopefully your exposure is as low as possible. So Mike already spoke a bit about ozone and pointed out that ozone is really built as a secondary pollutant together with heat or with sunlight, with UV light. So typically these levels are increased in the afternoons, and therefore one recommendation that we would like to put forward is that if possible, it does make sense to exercise in the mornings because that's the time when ozone levels are low. And if you can time it so that you are either exercising before rush hour, if you live in a city, or after rush hour so that this first peak has gone down, that makes a whole lot of sense. And then of course, it also makes sense to consider time on a larger spectrum. So say if you were to train for an event, say the Sun Run, I believe it actually just happened last Sunday, it makes sense to have an event like this early on in the year when fire season is still fairly low. Whereas if you were to plan a bigger event or participating in a large condition that requires training over the summer months, you might expose yourself to a greater risk of being exposed to air pollutants that are higher due to wildfires and so on. So now let's talk about how you can reduce your air pollution exposure by picking a good location or by reducing yourself from the source of air pollution through distance. So again, if I show you here the same heat map of NO2 and say I were now not interested to go to this Plaza Catalunya as I did before, but I just wanted to go for a run, what I can do quite nicely with this website is to ask for a place where air pollution levels are as low as possible. So what you see here are these circles, which are essentially indicative of all the air pollution measurement sites that we have here in Barcelona. So we're quite lucky, there are a lot of them. And what you see is if I just move up a little bit along the coast, that's where I can find the lowest air pollution levels on that day for Barcelona. And similarly to what Mike already said when he explained to you the study on blood pressure that was done on Georgia Street versus sort of the site right by the sea, I'm blanking right now on the name. This is the same setting here. So when you are close to water, where say there are fewer high rises, fewer say elements of the built environment that really capture your air pollution and trap it inside of the city, you're likely to find better, more cleaner air. And that's exactly the case here. You can see here, the air pollution for NO2 is quite a bit higher. This is an area called Eixample, and that's because there are more high rises. There are big traffic arteries that cars, motorcycles, and so on use just to get through the city. And because there are so many traffic lights, cars are constantly stalled and pollution really builds up and cannot leave the city. So what we do recommend is, if at all possible, avoid major traffic arteries, avoid traffic canyons, try to avoid dense built environments such as high rises, and if possible, choose to go and run along blue or green spaces or along sea, river, parks, anywhere where the air can flow better and you get a better circulation. Okay, so all of this, so I showed you the example with the distancing by time and distance with a Barcelona example, because I think it very nicely visualizes where the air pollution is. You do have very nice resources for all of British Columbia as well. And I point out here 2 links or 2 websites from the government of British Columbia, where on the one hand, you can pick the place where you live and then click at different air pollutants. You get a color-coded sort of indication of where current air pollution levels are at. You get 1 hour and 8 hour averages. And on top of that, you also get an indication for what the meteorological data. So for example, the heat levels are at, which gives you a bit of a sense of what might happen in the next couple hours, for example, to ozone, which we now pointed out multiple times is closely connected to ozone. And then I also like this BC air quality website, where you can really look at the different pollutants. And if you actually click inside of the figure, you can essentially zoom in or out of the time resolution and get a very good sense of the fluctuations of the air pollutants in the different locations. So if this is of interest to you, I do recommend those 2 sites. And then I'd also like to point out a really nice website by Metro Vancouver here, the GIS website, where again, you get the individual pollutants. You also get meteorological data. And what I'd like to highlight here is that you get very good information on the air quality health index. And Angela, this might a little bit also help with your question when you asked about the different pollutants and say, you know, when you look at ozone and together with particulate matter or together with NO2, it's sometimes tough to get a complete picture because you have this mix of pollutants. The nice thing about the air quality health index is that it is an index that goes from 1 to 10, with the higher numbers being more dangerous for health. And it takes into account all these pollutants. So it takes into account ozone, PM2.5, PM10, and NO2. So that is a good way of essentially orienting or deciding for yourself whether it's a good time to go and exercise. And final thing to point out here is that you get a bit of a timeline as well of what's been going on, say, in the past couple hours, which can be helpful for you to make a decision as well. And then lastly, I briefly touch upon wearable air pollution monitors that are becoming more and more available at lower cost. And as you can see, when you just Google wearable air pollution monitors, you might get very quickly overwhelmed because there are so many different types and it's hard to really get a grasp of how good they are. So if this is something that is of interest to you, I do recommend this website to you, which is called aqmd.gov. It's an American website, but they are essentially, without any commercial interests and so on, assessing the performance of different wearable monitors. And so if you were interested into investing into something like that, that's a good place to inform yourself, find out what are the pros and cons to the different devices that are available so that you can essentially use the data accordingly. All right, so here the summary, again, definitely make use of all these resources. And we do recommend the use of the Air Quality Health Index, particularly because it's a nice way to get a bit of a more global understanding of how the different pollutants together need to be looked at with respect to their effect or risk on health. Okay, so now we'll get to Gloria's and Cornell's questions or points about the ability or opportunity to move exercise indoors. So yes, that is definitely an option, but as was correctly pointed out, it's not, say, that straightforward or that simple, because depending on the quality of the building, on the insulation, but also depending on certain air pollution sources inside the rooms, you might actually expose yourself to air pollution as well. So here we're really thinking about things like air fresheners, disinfectants, personal care products, say the flooring that is in the room, also the type of paint, whether it's new paint or old paint. If you are into winter sports, you might be using different types of waxes, which can generate fumes. If you're a weightlifter or if you go to climbing gyms, chalk can be a contributor to pollutants. And then, of course, everybody who's in, say, ice arena or ice rinks has to consider or account for pollution that can be generated by the use of Zambonis or ice resurfacing machines. So essentially, as was already correctly said, moving indoors can be an opportunity to reduce air pollution exposure when the levels outside are very, very bad. But you do need to consider sources of indoor pollution. And on top of that, you need to consider, say, ventilation practices that are being applied to a specific room or a building, like how often are the windows being opened? Does the air actually flow through, or is the air just standing inside the room? Also, are there any filters like HEPA filters that could actually contribute to making the indoor air better? So filtering the air that comes in from the outside so that we do in fact have a better air quality inside compared to outside. Okay, so now talking about acclimation. So Mike already showed you one study, and you can just see here, if you briefly skim through the headlines of some research studies that were done, that it seems that some acclimation to ozone with respect to lung health or lung symptoms is actually possible. Mike already showed this study on the varsity athletes to you, so I'm not going to go into depth here, but say our take home after digging through the literature was really that yes, repeated exposure to ozone, sort of the days leading up to a competition or to being physically active, can help in reducing or preserving your respiratory function, your respiratory health. But again, there's very little research out there. We don't know enough about other pollutants. So more work for us to be done there. So now let's shift gears a little bit and think for a moment about how exposure to air pollution before we exercise might affect our health. Because so far we've been talking mostly about the effect of air pollution right during exercise. So let's see what we know about the effect of air pollution exposure before we become physically active. I'm now here showing you again a study design at the top that was done again by our colleague Louisa Giles in this air pollution chamber that you saw at the very beginning. You can see here that this study was set up a bit differently. So what happened here was that Louisa invited participants to come to the laboratory. They did some health measures at the beginning, and then they just sat inside the exposure chamber for 60 minutes. just relaxing, watching Netflix, sitting there, doing whatever they wanted to do, but not exercising. Then they came out of the exposure booth. The same measures as at the beginning were repeated. And then participants performed a 20-kilometer cycling bout while breathing clean air. So while they were exercising, they were actually not exposed to diesel exhaust. They were breathing perfectly fine, clean air. And when you look at the bottom on the left side, I'm going to show you some of the key results that Luisa found for lung function. You can see each line here represents one study participant. On the left, you always see the filtered air condition, and on the right, the diesel exhaust condition. And first, we're just going to look at what happened to lung function after participants sat for 60 minutes in the chamber, breathing filtered air or diesel exhaust. And what you can see is in most people, lung function sort of was decreased after that 60-minute period when they were breathing diesel exhaust when compared to filtered air. So essentially, people's lung function decreased over the duration of these 60 minutes when breathing diesel exhaust. So that's something we're concerned about, because if they start to exercise now, they're already at a disadvantage. They're already having somewhat narrowed airways. What you can see on top of that is when Luisa assessed, okay, what happens after the cycling bout, the 20-kilometer cycling bout? You can see here again, most of the participants actually improved their lung function when they were breathing clean air here at this point of the study. And that's really what we anticipate to see. Exercise typically helps us to open up the airways, at least in healthy people, people who don't have respiratory disease. However, this beneficial effect of exercise was actually reduced or attenuated when people were breathing diesel exhaust 60 minutes before the exercise bout. And when we look at a different health outcome, which is here, heart rate during the exercise, you can bout that the individuals on average were biking at a higher average heart rate when they were previously exposed to diesel exhaust. And overall, what we can take away from Luisa's study is really that we need to not only consider air pollution exposure during exercise, we also need to be mindful or aware what kind of air we are breathing before we become physically active, because there can already be effects on our respiratory, on our cardiovascular health that might have effects later on when we are active. So really, what we do recommend is to keep your pre-exercise air pollution levels as low as possible. So you might wonder, what are the ways we can achieve that? One way of doing that is to be mindful how you travel to your exercise location. So for example, are you going by car? Are you going by bus? What kind of ventilation system does your bus or your car have? Is it maybe better to close the windows and turn on the AC so that you're breathing clean air and not being exposed to pollution? Things like that. Another way, of course, could be to wear a face mask. So the COVID-19 pandemic has made us very familiar with different types of face masks. And I guess I don't need to spend much time to tell you about the importance that, of course, face masks, for them to be effective, for them to really be filtering particles out of the air that you then breathe, they need to be put on correctly. They need to fit your face properly, and you need to wear them continuously. Like just wearing them, say, 5 or 10 minutes before you exercise might not actually be sufficient. You might need to wear them, say, for the entire time of travel to your exercise or competition destination. And of course, very important as well is that you replace the face mask or the respirator or the filter regularly to make sure that the face mask can really do its job. So generally what is recommended, or what we do recommend, is that you wear face masks outside of training and competition for the purpose of really lowering your pre-exercise air pollution exposure. All right, so we're almost there. Now we're at the point of talking about medication. And this is a research study that I did as part of my PhD. Again, you see the same exposure booth as from the very beginning. And what I was interested in was to see whether the use of an asthma medication called salbutamol, which is known to open up the airways, essentially reduces or makes the effects of air pollution worse when we exercise. And the reason for that being, that the use of this asthma medication could potentially override a protective effect by just pharmaceutically keeping the airways open. And I want to point out that this was a study that was done in people who suffer from exercise-induced bronchoconstriction, which is more or less the same as exercise-induced asthma. And what I found was that this asthma medication, so salbutamol, did its job perfectly well. It did open up the airways. It actually even reduced the metabolic cost of breathing during the exercise bout. And this was not affected whatsoever by diesel exhaust. On top of that, participants did not really perceive the discomfort of breathing or the level of breathlessness any different during exercise, whether they were exposed to diesel exhaust or filtered air, and with or without the asthma medication before the exercise bout. And then finally, there was no effect on participants' airways up to 30 minutes and then even up to 90 minutes upon completion of the exercise bout. And what we can conclude from that is really that there is no evidence that people should change their medication intake. They should continue taking their medication, particularly their asthma medication, the way they have been prescribed to do, because so far there has been no indication that there are negative effects when people exercise in air pollution. And then finally, when we talk about supplements, so when we dug through the literature, what we did find is that beta carotene, vitamin E, and vitamin C, at least 1 week prior to competition, might help reduce respiratory symptoms or respiratory function decreases when exposed to ozone. So there's some indication to that. And with that, we're really at the end of my part of the talk. I'd like to thank everybody who has really worked on this project together with Mike and I. Thank you very much to Andy and everybody else who is listed here. For all of you, you can access this article online. And here, what I believe is a nice part of this article is that we generated this infogram, which is really a summary of all the strategies that I have just summarized in this talk. And you can use this as a cheat sheet, either for yourself or say the people you go and exercise with. Maybe you are a coach and you want to distribute this. So you can find it online, and it should also soon become available on the Canadian Association for Sport Medicine website in both English and French. And if you cannot find it, please feel free to email us, and we're definitely more than happy to share this with you. Thank you very much.
Oh, that's great. Thank you so much, Sarah. Yeah, such interesting, thoughtful work. I'm going to remind everyone to use the Q&A feature at the bottom of the screen, and to send in your questions to Sarah. Sarah, well, we've got one here from Paula, but before we get to that, I just wanted to ask, are there sport organizations, are there recreation centers where you see a really good implementation of these kinds of guidelines? Are there jurisdictions that are, that we can emulate in terms of providing some really clear parameters about when you call off or when you shift activities in response to air quality?
I think really what we're trying to do, is essentially to tackle this whole issue step by step. So essentially really by putting these guidelines together more on a personal, individual level, we really hope to first reach the individuals, like the people for whom it really matters, right? And then all together with all the air pollution research and physical research that's going on, we're trying to gradually go up the ladder to say a local level, to a national, international level, to then really promote not only the personal level strategies, but also to talk about more comprehensive ways to reduce air pollution, say indoors, in gyms, in recreational facilities, but then also obviously globally, So there's a lot on the way, but I think we need to take it step by step. And I don't know if Mike actually has more that he might want to put in, but I think that's sort of how I view it right now. We really need to take a broad approach and really send the messages and the ways that people can protect themselves to the different layers, and then hopefully get a global approach in tackling this syndemic.
Mm-hmm.
Just to add to that, in terms of events, like canceling events or postponing them, the Triathlon BC has a nice policy. It's sort of quite pragmatic. I just put it in the chat there. And the NCAA also has a policy, but other than that, there aren't a lot of organizations, like there isn't that I'm aware of, there isn't an IOC or a FIFA policy for anything like that. So this Triathlon BC one, I quite like it. And I think it could be extrapolated to other activities.
Thanks, Michael. Yeah, we've had a look at that Triathlon BC one and think that it's really relevant. You know, I'll have to confess here, I've got kids in sports and little baseball players, and you know, we had a double header on one of those days when it was 32 degrees, and the coach ended up calling it during the second game, which was problematic because if the other team hadn't agreed, we were worried about. I mean, that was more a heat issue, in that we were worried about the kids having heat exposure. But I do feel like as community leaders and sport leaders, we have a role to play in terms of making things, setting out some clear parameters for. Especially for volunteer coaches and that sort of thing. I have a question here from Paula, who has a very good question, who asks, do you have key recommendations for communities where there is no air quality monitoring?
So I think all the key recommendations for communities where there is no air quality monitoring. Really, I think anything from, like, essentially you're stepping in the dark. You don't know exactly what your air pollution levels are like, but all the recommendations that we have put forward, they do help or should be applied even if you don't know exactly what you're being exposed to. So with that being said, like, if you have the opportunity to exercise, say, along a blue space, along a green space, I would always recommend that, as opposed to, say, running through the center of a city, because air pollution levels will be higher likely in the city, in the center, than when you are in a park where there is no traffic. So I think actually most of the recommendations that we have provided, other than the air pollution monitoring, can be useful and should be used, even when, you don't know your precise exposure levels.
And I'll just jump in and tell you, Paula, the Triathlon BC guide actually has a really interesting measure for the leaders for events, for running events, for triathlon events, where they use a visual substitution there, where there's not air quality monitoring. And so it's it sets out, like, if you can see for this amount of distance, then your air quality is likely compromised. So you might want to check that out as a reference. It is challenging, though, where you don't have that information. I've got another question here from Cornell, who says, the recommendations seem to be for the public at large. Is it really necessary to include medication when the general public just wants a bit of exercise?
Yeah, so I don't know if I was misunderstood, and I do apologize if that's what actually happened. So we're not recommending that, anybody just start taking medication. It's more that if you have a pre-existing condition, so if you have been prescribed, for example, to take asthma medication, to help you to actually be physically active, because again, say if you have asthma, there's a high probability that before you exercise, you might need to take that medication just to help you with the breathing. So in those circumstances, we do recommend that you don't change your habitual use of the medication. So I do apologize if there was a misunderstanding to this.
Well, that's great. Thank you so much for that, Sarah. And thank you, Sarah and Michael. I think we've run out of time. So the last question that we've had that I just want to answer is will you be posting this information? And we absolutely will. We'll make sure that we include those resources with when we post the webinar and the presentations. So just really, really want to thank both of you, Sarah and Michael, for sharing your research and the depth of information that you have on this. It's really interesting and so timely right now. And, you know, just really wanting to see you do more of this great research so that we can continue to address this complex challenge of this syndemic. And just want to thank all of our participants for joining us today, for our audience, for your attention and thoughtfulness and some really great questions. So we're so glad that you could join us today, and we'll be following up with a short survey. So I hope that you'll respond, as it really helps us to plan these kinds of events and see what's of interest and what we can do better. And then of course we've got all of our contact information there in terms of our Twitter and Instagram, and so do stay connected with us on social. And yeah, I just want to wish everyone a fabulous day. Get outside while the air quality is great, and get out there and be active however you can, because it will make you feel better. Okay, thanks everyone. Have a good one.
Thank you.